Good afternoon. My name is Jacqueisha, and I am a student at the Mental Health in the Digital Age Lab. Today, I'll be talking about how to protect your health information. Health information is very personal, and many people don't realize how often it's shared, stored, or accessed both online and offline. With more healthcare services moving online, protecting this information has become even more important. During this presentation, I'll explain what health information is, why it's important to protect it, and simple steps people can take to keep their information safe. I'll also talk specifically about children and youth, since they are active internet users and may face additional risks when it comes to online privacy. What is health information? When we think of health information, we often think only of medical charts or doctor's notes, but health information includes much more than that. Health information includes things like medical records, test results, prescriptions, diagnoses, health card numbers, and insurance information. It can also include information stored in online patient portals, health apps, or school and workplace health forms. Anything that can identify a person and relates to their physical or mental health is considered health information. Because this information is sensitive and personal, it needs to be protected carefully. Why protection matters. Protecting health information is important for several reasons. If this information is accessed by the wrong people, it can lead to identity theft, fraud, or misuse of health services. Protecting health information also helps maintain privacy. Health experiences are personal, and individuals should have control over who sees or knows about them. In addition, secure and accurate health records help healthcare providers give safe and appropriate care. When people trust that their information is protected, they are more likely to seek care and be honest with healthcare professionals. Protecting your health information online. Many people now access their health information online through patient portals, apps, or email, which makes digital protection very important. Using strong, unique passwords for health-related accounts helps prevent unauthorized access. Two-factor authentication adds another layer of security by requiring a second form of verification. It's also important to make sure websites and apps are secure before entering personal information. Avoid using public Wi-Fi when accessing health accounts, as these networks are less secure. Finally, always log out after using health portals, especially on shared or public devices. Protecting health information online for children and youth. Children and youth are frequent internet users and may use apps, games, social media, and online learning platforms that collect personal information. Because they may not fully understand privacy risks, they need guidance on how to protect their health information online. Youth should be encouraged to use privacy settings on apps and social media to control who can see their information. They should also avoid sharing personal health details online, such as diagnoses, medications, or mental health experiences. Creating strong passwords and keeping them private is another important step. Children and youth should be encouraged to ask trusted adults before signing up for apps or websites that request personal information. Internet safety for youth. Internet safety is an important part of protecting health information, especially for children and youth. Many quizzes, surveys, and so-called free apps collect personal information even when it's not obvious. Youth should be encouraged to be cautious and think about why an app or website is asking for information before sharing anything. Reading app permissions before downloading is another important step. Permissions can show what information an app can access, such as photos, contacts, or location, and not all apps need that information to work. Avoiding unknown links is also important, as these links can lead to unsafe websites or attempts to collect personal data. If something looks suspicious or feels uncomfortable, that's often a sign to stop and not click. Most importantly, children and youth should know they can talk to a trusted adult if something feels unsafe or confusing online. Open communication helps young people get support and make safer choices on the internet. Although digital information is common, protecting health information offline is still very important. Paper documents that contain personal health information should be stored in a secure place, such as a locked drawer or folder. When documents are no longer needed, shredding them helps prevent information from being accessed by others. It's also important to limit who you share health information with and to be cautious when discussing health details in public places. Simple steps like these can significantly reduce privacy risks. Know your rights. Many people are not aware that they have rights when it comes to their health information. Individuals have the right to access their health records and request corrections if information is inaccurate. They also have the right to know how their information is being used and who has access to it. Healthcare organizations are expected to follow privacy policies and protect patient information. If someone has questions or concerns, they can ask healthcare providers about how their information is handled. Key takeaways. To conclude, protecting your health information is an important part of protecting yourself. By taking simple steps, such as using strong passwords, being cautious online, protecting paper records, and knowing your rights, individuals can greatly reduce risks. For children and youth, guidance and open communication with trusted adults are especially important. If something doesn't feel right, it's okay to ask questions or speak up. Protecting your health information protects your privacy, your safety, and your well-being.